Feeling worried or anxious from time to time is a completely normal experience. For many of our teenagers, worries can be either fleeting and specific to a certain event or situation, or can persist and be more generalised but still remain within a normal range and feel manageable to them. For some, however, anxiety affects their lives to the point where the result is significant disruption to their emotional well-being, their behaviour, and their engagement with the world around them. According to the World Health Organization, anxiety is the 6th leading cause of illness or disability in 10 to 14-year-olds and 9th for those aged 15 to 19 years. Perhaps more than ever, our teenagers are battling anxiety that comes from a whole range of sources, from social pressures to getting the right number of Instagram likes, through to more general conformity, approval from others, and meeting expectations. In this lesson, we are going to learn how you as a parent can distinguish between those worries that will pass by for your teenager without impact and those that may require additional attention and support. We're going to spend some time thinking about the symptoms of anxiety in teenagers and about what commonly contributes to them experiencing such difficulties with their mental health. We are going to learn what is happening in your teenager's brain when they're feeling anxious and how we can use this knowledge to help them to overcome the experience. And then we will end with offering you some ideas and some strategies for how you can help your teenager at times of such struggles. Before we start, when thinking about any aspect of your teenager's mental health, if you or someone else are concerned, we would strongly advise that you seek additional professional help alongside this lesson. This course is not sufficient to replace professional support where needed, but it is intended to help you build your awareness and understanding so that you can make accurate judgments and decisions around how much support is needed moving forwards. So, what are the signs of anxiety in teenagers? Anxiety is a feeling of worry or fear that is typically experienced as a combination of physical symptoms, sensations, thoughts, and feelings. Worry is a normal part of life, and there are events throughout childhood that are likely to trigger feelings of anxiety or fear. These might include the first day at school, meeting new people, sitting exams, or doing your driving test. At such times, your teenager may comment to you that they're experiencing some of the common signs of anxiety. This might include physical sensations, such as that butterfly in the stomach feeling, needing the toilet more, feeling sweaty or shaky, a faster heart rate or rapid, shallow breathing, feeling sick or getting hot. They might describe thoughts or feelings that relate to their anxiety, including being preoccupied with upsetting or negative thoughts, feeling on edge or panicky, feeling overwhelmed or out of control. And they might notice this impacting on their functioning, as they're finding it difficult to maybe concentrate, they're avoiding situations that elicit the anxiety, or are experiencing difficulty sleeping. They might then be seeking out ways of coping with this anxiety, not all of which may be healthy or effective, such as withdrawing and becoming isolated, eating more or less, self-harming, or developing rituals or routines that may become obsessive. So what might be going on in your teenager to cause them anxiety? Anxiety, or the more extreme version of that is fear, is an emotional state that is induced when we perceive there to be a threat to our well-being or survival. As with depression, there's a genetic component to anxiety, so if your teenager has a family history, this may increase their vulnerability to also experiencing it. There may also be a learned behaviour component, whereby if your teenager has been exposed to other people's anxiety, they may have absorbed this into their own psychological state and learnt to respond to potential sources of anxiety in the same ways. Again, much like depression, which occurs frequently alongside anxiety, we know that our brains have a role to play also. Perhaps not surprisingly, it's again the emotional parts of our brain that are thought to be responsible, and this is connected to how the brain perceives threat within the environment. Theories around anxiety therefore argue that an overactive amygdala may lead to anxiety, or more likely that there's a fear system within our brains that gets triggered when the information being processed suggests that there's a threat around. It's thought that this system involves the communication once again between the emotional and the thinking brain. So in anxiety, it's the emotional brain that perceives the threat, and then the thinking brain that rationally considers whether this is a true threat, and if so, how best to respond on the basis of whether it's something we actually do need to feel anxious about or not. This may result in some situations where the emotional and the thinking part of the brain agree that it's entirely appropriate that we're feeling anxious or we're not, and other times when perhaps they disagree. In this scenario, in the adult brain, even if the emotional brain is processing threat, if the thinking brain disagrees, this will override the ultimate outcome and the adult is not as likely to feel anxious. In this same scenario in the teenage brain, however, the immaturity in the thinking brain means that the emotional brain rules. So even if rational and logical thought would disagree, they end up still experiencing anxiety. The result of this can be that more situations are deemed to be threatening to teenagers, or anxiety gets experienced as a bigger feeling because it's not moderated by the thinking brain. Threats to safety or well-being that may lead a teenager into experiencing anxiety can come from a number of sources. These might include change and feeling out of control. That could be moving house or school, losing a loved one, or feeling unsafe as a result of bullying, trauma, or abuse. They may have to take on responsibilities beyond their age or ability, such as caring for others, or may be under pressure to perform in exams or at school. They may feel a high sense of expectation from others, and the need to be perfect, and so not achieving this standard is what creates anxiety. Or they may be around others who are anxious or stressed, either as part of their character or in response to other life events such as debt or job pressures. So, what should you do if you think your teenager is suffering with anxiety? Just like any other difficult emotional experience, if your teenager is experiencing those symptoms mentioned previously, but they don't last, or they've already perhaps found ways that are effective in terms of overcoming them, it doesn't need to cause too much concern. Experiencing and learning how to deal with adverse experiences builds resilience, and so having a life without challenge can actually starve our teenagers of the opportunities to learn how to sit with and cope with difficult things. However, when or if your teenager's anxiety appears to be something they are stuck in, when it's feeling overwhelming and causing them distress and leading to unhelpful behaviours, they may benefit from some additional support. If you or someone else is worried that your teenager is experiencing anxiety that is causing them this kind of distress or impacting them significantly, it's important to seek advice from a professional. This may be your GP or physician in the first instance, and they can then guide you to further services that may be able to offer support. If your teenager is over 16, they have the right to go to a doctor on their own and for conversations to be kept confidential. If they're under 16, they can still consent to their own treatment if they're believed to have capacity and competence to fully appreciate and understand what is involved in that treatment and what the implications are. Evidence-based guidelines that are available in the UK suggest that treatment for anxiety in young people should come in the form of psychological therapy, namely cognitive behavioural therapy that we'll talk about later. Medication is also available, although this should be prescribed only with advice from a qualified professional and in more severe cases of anxiety after therapy has been tried. If you go down the route of seeking support through therapy, remember that you may not find the right therapist straight away. The effectiveness of therapy comes largely from the relationship that can be formed between the therapist and their patient. So your teenager may have to try out a few different therapists before they find the one that makes them feel comfortable and safe. This is not unusual. They may also want to experiment with different forms of therapy, and again, this isn't unusual. If you go down the route of medication, make sure you and your teenager are clear about both the benefits and any side effects, so this is an informed decision that's being made. If they require to take medication during the day, when at school perhaps, make sure they feel comfortable doing this. They might need some help, maybe being reminded, so maybe they might need an alert on their phone or a teacher to prompt them. With either of these options, it's important to remember that things can get worse before they get better, so don't be alarmed if this is the case for your teenager. Speak with the professional involved if you are concerned with any worsening of symptoms, and they'll be able to advise you accordingly. As well as talking with a professional or seeking external support, it's also important to remember that there are a number of things that you can do to help your teenager with their anxiety. Most importantly, ensure that you're able to offer them a safe, empathic and non-judgmental space in which they can talk to you about their worries. If you go back to previous lessons in part 2 of this course, you'll find more ideas on how you can have such conversations with them. This may be facilitated by them having a notebook to write down their worries in, and then creating a specific time of the day or week to go through their worries with them. This may be all that is needed to allow them to sit with those feelings, have their experiences validated, and allow them to be accepting of the anxiety that they're feeling. It may then allow you to come up collaboratively with ways of reducing their anxiety or taking the sources of the anxiety away. If they're struggling to have these kinds of conversations with you, perhaps see if there's someone else they would feel comfortable talking with. This might be a family friend, a relative, a teacher, or another professional. If talking isn't sufficient, however, there are lifestyle changes that your teenager can also engage in to help when their anxiety is peaking. These might include physical exercise, which may range from a vigorous sport through to a gentle dog walk. Ensuring they're eating a healthy diet that's low in sugar and fat and high in fruit, vegetables, grains and lean sources of protein. You should also encourage them to cut out or reduce their intake of stimulants, so caffeinated drinks or alcohol, as these can often trigger the physical symptoms of anxiety such as a raised heartbeat. If your teenager's anxiety stems from taking on too much, it may help to look at their responsibilities or the demands on them, as it may be possible to break things down into more manageable chunks or even to drop some activities to make it all feel more achievable. Relaxation and distraction strategies can also be helpful, and whilst these do not get rid of the source of the anxiety, they can be effective temporary strategies to get your teenager through a difficult patch. Visualization, relaxation, meditation, deep breathing and yoga can all be effective ways of relaxing, using all of the senses, so thinking about touch, sound, smell, taste and sight to encourage those worries away. There are a number of other ideas that you can look at with your teenager in the accompanying resources to this course. If your teenager experiences their anxiety as panic, possibly even having panic attacks, you can support them by helping them to understand that anxiety doesn't last forever. Typically, after a trigger for anxiety is experienced, levels of anxiety will shoot up quickly until they reach a peak. During this time, your teenager will probably be experiencing a range of those symptoms that were described earlier. However, once the anxiety has reached that peak, the body and the brain cannot tolerate staying in that state for long, and so eventually it will come back down again. Typically, we don't let ourselves reach that peak because we have strategies to avoid the anxiety getting that high, whether that's deciding to turn back from the party or leaving the room because there's a spider in it. Avoidance is something that we all do, especially because it's such an effective management strategy for anxiety. However, the downside to avoidance is that it only works in the short term. What it doesn't do is allow your teenager to learn that 9 times out of 10 their anxiety is not rational or necessary. If they go to the party, they will find someone to talk to, or if they stay in the room with the spider, it's not going to hurt them. You can help your teenager to understand this and help them to learn what the early signs of anxiety are for them, so that they can then engage in strategies before it gets too big, but also engage in strategies that will give them longer-term relief from that anxiety. So in addition to those already mentioned, some other such strategies that can be used in the moment may include things like drawing, painting, listening to music, seeing friends, reading or watching a favourite film or TV programme. Some teenagers may benefit from having a soothe box, so that's a box that contains items that tap into all the senses and that can be used to help them to relax and to feel better. So it might include things like a nice smelling essential oil or a candle, a nice body lotion, photos of a favourite person or a place, a notebook to write things down in, a mindfulness colouring book, positive quotes or sayings, or maybe some nice edible treats. Ultimately, the long-term management of anxiety, however, comes from tackling the source. And this is the aim of cognitive behavioural therapy, or CBT, where the goal is to identify what we call core beliefs that may then drive the experience of anxiety. These core beliefs may originate from earlier in life or from specific events that have occurred. Anxious core beliefs of this kind can include things, therefore, like the world isn't safe or I'm not good enough. And when a core belief is triggered, the model of CBT argues that this feeds into our feelings, which feed into our thoughts, which are then experienced in our body as well as expressed in our behaviours. So they're all connected. And because of all being connected, the underpinning of the model is that if we can change one of these aspects of us, the others will also change. So if you can change the thought, I'm not good enough, to I am good enough, the associated feelings, behaviours and bodily sensations will also change. This may be an approach that's offered to your teenager in therapy, but you can also gently challenge some of the anxious thoughts your teenager is having by encouraging them to look at the evidence or lack of for those thoughts that they're having. You can do this on the basis of evidence and information that's already available to you or your teenager. Or you can test out the hypothesis that they believe to be true by creating a situation to see what is the evidence going to show us. Typically, what you find when you do these kind of experiments is that there is more evidence to the contrary of these beliefs or thoughts, and you can then encourage your teenager to shift into something more balanced or positive. So instead, they may believe the world isn't safe, but there are things that can be done to make it feel safer. Or they may not have done brilliantly in their exams, but they've done well in some of them, and that's okay. Remember, it's important that whilst you want their beliefs and thoughts to change, they need them to be validated and accepted first, however irrational or even ridiculous they might sound. Validation allows your teenager to feel accepted, and this helps them to then be accepting of themselves. This is in contrast to reassurance, which we all do because it often feels like the right thing, but which can actually be invalidating because it doesn't match how they are feeling in that particular moment. So if we say, oh, don't worry, honey, at least you passed some of your exams, when they're really feeling rubbish, this isn't going to make them feel any better. We firstly need to connect. We need to empathise and validate, and that way your teenager will know that it's okay to feel rubbish when things like this happen, but it will be okay in the end. Finally, it's important that alongside the support you can offer your teenager, you find ways of looking after yourself too. Try not to blame yourself. This isn't always easy, but remember what we've learned in previous lessons, that sometimes we need to look at how something's making us feel it first, and that will then determine how we respond to our teenager. Remember also that if you have significant concerns, there are services out there to help. This is not something that you have to manage on your own. It's much better to seek help and then be reassured that perhaps you may not need it, than to wait or not ask at all and then things become too late as they've escalated. So hopefully this lesson has helped you to be more aware and have more understanding of your teenager's anxiety. It's hoped that you now have a better idea of whether your teenager is experiencing the kind of typical worries that everyone experiences from time to time, or whether they need some additional support and help. If it's the latter, this lesson has hopefully given you some practical ideas and strategies for how you might be able to support them to understand their own anxiety better and find more effective, longer-term ways of managing it. As with our previous lessons, if you feel comfortable doing so, please share any of your observations, experiences or thoughts with us in the comments. We'd love to hear about all your experiences with your teenager and how you're finding these lessons to help you understand and relate to them better. Thanks ever so much for watching, and we'll look forward to seeing you for the next lesson.